Now, I wanted to invite Al to come out. I mean, you know, he's a freshman senator. You know, freshman senators, they aren't known very well. He is. So I figured, what the heck, I might give him a little exposure. Might get to be known a little bit, you know, if he starts out here in the steak fry. But Al has been a great friend of mine for many years, going back 20-some years, that we've intersected at different times. A real student of government and politics, a master of understatement. Well, I mean, he wrote this book called Rush Limbaugh's a Big Fat Liar. I mean, that's an understatement. Couldn't ask for a better friend, and I'm glad that Minnesota now has two good progressive Democratic senators, and let's give him a warm welcome. My good friend.
Thanks, Tom. It's so great to meet so many of Tom's friends. Many of you I've met before. I've come down to Iowa and did a number of things. I did a Chamber of Commerce dinner. I did a JJ dinner. They're slightly different audiences. But both are fun. And what's great is coming to another state, in Iowa, of course, is our neighbor in Minnesota and to the south. And what's great about doing an event like this is I really can't forget someone to thank. I don't need to thank anybody.
I donated to you.
Except for the interpreter. Doing a terrific job. She's really great. I hate to keep talking about myself like this. Mr. Franken didn't really thank me. Bad conceptual joke. So, let's see. I can't tell you how thrilled I am that I'm going to be, my chairman is going to be Tom Harkin. This is health, education, labor, and pensions. It's not that big a deal. It really, the only people who really care about the work done there are people, you know, who might care about their health. Or have a kid whose health they care about, or who want to send their kids to, you know, a good school, or who work. Or may want to retire. With a, you know, a pension. Anyway, so it's not that. Only those people really care about the work that's done in that committee. And and obviously we have this enormous opportunity. People voted for change. People, when I campaigned in 2008, it seems like a long time ago. When I went around Minnesota, people raise three things. They'd say, my health care costs too much, my insurance costs too much. My wife or my husband or my kids, one of my kids has or I have a pre-existing condition. And I'm worried that if I lose my job, I won't be able to get health care. Or if I want to start the small business I've always wanted to start, I won't be able to do it because I won't be able to get health insurance. And this is supposed to be an entrepreneurial society. But I've met so many people that felt stuck and couldn't open that great idea they had, couldn't start that business because of a pre-existing condition. Well, that's not going to happen anymore. And there, people would say to me, I got sick, or some of my family got sick, and I had insurance, but I went bankrupt. More than half the bankruptcies in this country are caused by healthcare crises, and more than 2/3 of those people who go at personal bankruptcies because of a healthcare crisis had health insurance. That doesn't happen in other developed countries. We're going to put an end to that. And Tom and I are focused on getting the costs down, getting the cost curves down. And you know, Minnesota and Iowa are in the top quintile in health. I've been at a number of healthcare forums in Minnesota with health professionals and providers and insurance companies and healthcare economists. A healthcare economist and one said, well, in Minnesota we get an A, but that's because we grade on a curve. And we got to bring up the rest of the country. And the way we're going to do it is Tom wrote the preventive title in the health bill. And we're going to focus on incentivizing doctors and nurses and nurse practitioners and the healthcare system to keep people healthy and to treat people with chronic diseases so they don't get worse. Because right now we don't have a healthcare system, we have a sick care system that is perverse and incentivizes doctors really to keep their patients sick, because that's how they get paid. They get paid for tests and procedures, and they don't get rewarded for delivering quality at a low cost. And we're going to change that. The money to do this, the money to reform our system, is in the system. Every other industrialized country provides universal health care and does it at about half the cost that we do per person and has better outcomes. We're not dumber than the rest of the world. We just got a bad healthcare system. We're going to change it. And we're going to change it this fall. So thank you for your continued support of Tom, your continued support of the Iowa Democratic Party. Thank you for the music. That was beautiful. Thank you again for the amazing interpreter that you have. She is quite simply the best interpreter I've ever had the opportunity to work with by a factor of millions. It is astounding how big she is. Okay, stop that. Look forward to seeing you at the steak fry. I was invited to one 8 years ago, but it was the one that was canceled because of 9/11. So I'm really looking forward to this one and eating my fried steak. I know it's not fried, it's grilled. And even more looking forward to that. Thank you for supporting Tom. Thank you for supporting the Iowa Democratic Party. Thank you for supporting one of the great progressives in the United States Senate, my chairman, Tom Harkin. Thank you.